Ministry of Health, St. Kitts.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart. And always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or use an alcohol-based hand sanitizer.
When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
a safe environment
and embrace
a border reopening lifestyle.
The symptoms of the coronavirus are...
Ladies and gentlemen, may I present Team COVID-19. Step into the mic. In the studio is Dr. Laws, our beloved CMO, Medical Chief of Staff, Dr. Wilkinson, and Mr. Lesroy Williams, Team COVID-19 on the front line, coming to you in Calypso rhyme. So sit back, relax, and listen to what they have to say and the role they want you to play. Easy! In January this year, our federation woke up in fear because a little virus out there in Wuhan was slowly making its way to our land. They say its name was SARS Corona, and our lives it planned to devour. So we're here to come up quickly with a little plan to save our beautiful nation.
Then plan they will get. Because of people's lives we have to protect. Close down the airport and send back them big tourist ships so we could focus on this pandemic. Mr. MCS, I'm begging you please, as I pray to God from down on my knees. Now let's get all our hospitals and staff in order to battle this corona.
Is on. Good afternoon and welcome to another National Emergency Operations Center COVID-19 weekly briefing for the 3rd of February 2021. I am Les Roy Williams. Thank you very much for joining us for today's briefing. We continue to update you with information pertaining to the management of the COVID-19 pandemic here in St. Kitts and Nevis. Of course, information is crucial to the management of the pandemic. And at every weekly briefing, we bring you persons who are members of the National COVID-19 Task Force to update you with pertinent information so that you can be up to date and know what you are to do. We continue to advise and to encourage people to adhere to the safety and health protocols that have been put in place for our safety in the Federation. Of course, the COVID-19 pandemic is still with us, even though there are now vaccines on the market. Of course, we still have to adhere to the pharmaceutical measures that have been put in place, that is the covering of the nose and the mouth with the face coverings, the mask, the sanitization of one's hands, and the maintenance of social and physical distancing. I want to invite first to the podium Superintendent Cromwell Henry, who will give us an update with respect to what is happening in terms of the COVID-19 regulations that have been put in place. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast by whatever means. Today I will speak to you on the provisions of the COVID-19 Prevention and Control Act with respect to events, including events on beaches, public beaches. I will do so against the backdrop of the increased risk of spread of the virus in our communities. We are well aware that social events bring people together in ways that facilitates the spread of the virus from person to person. Some may say that there is no COVID-19 in the community and that all the cases are contained and are in quarantine. This may be so, but not entirely so. The truth is, we do not know when there will be a case of COVID-19 in the community. While our protocols have proven to be effective in containing the virus, we are seeing some lapses which have led to some uncomfortable situations. For example, over 20 persons were placed in quarantine over this last weekend as a result of one of such lapses in adherence to the protocols. This particular lapse, of which I speak, resulted in a positive COVID-19 case being discharged from quarantine into the community via public transportation. As a result of the incident, as soon as this incident came to our attention, the COVID-19 task force activated its response mechanism immediately. The positive case was identified and quickly placed in isolation. A vigorous contact tracing exercise ensued, and all identified contacts were immediately quarantined, including the public service driver who was not observing the basic COVID-19 prevention protocols. The protocols at the quarantine accommodation in question was reviewed and remedial action taken to prevent a repeat of this. Contact tracing in this case is still ongoing, along with a police investigation to determine whether or not criminal charges will be filed. Having highlighted this particular incident, and there are others, This drives home the point that we are to always observe the protocols and the provisions of the law which are intended to prevent the spread of the virus. Section 12 of the COVID-19 Prevention and Control Act provides a person may visit a public beach for the purpose of swimming or exercise, where there shall be no more than 8 members of the immediate family being in close proximity to each other. There shall be no picnics, beach parties, or other gatherings, and all persons shall adhere to social distancing and physical distancing protocols on the beach. Section 9 states, no person shall host, attend, or visit a social activity or gathering of more than 25 persons, including a private party, a banquet, ball, or reception, any ceremony in any public facility, or any other type of social event, except with the written permission of the Commissioner of Police in consultation with the Chief Medical Officer. Where permission is granted for any event, there are always a set of conditions that follow. These conditions include the recording of names of attendees and strict adherence to the basic preventive measures of wearing face masks and good hand sanitization and hygiene practices. I will add in closing that whenever permission is granted for an event at a specific venue, that permission is not transferable to another venue. Permission must be sought for any change of venue. Changing the venue without permission will automatically void the permit. I repeat, if you are granted permission for an event at a particular venue and you wish to change that venue after the event has been approved at that venue, you must seek permission to have a new venue allocated for that event. If you do so without getting permission, that voids the permit, and you will not be allowed to have the event at the new venue. We ask for your full cooperation and to always remember to wear your mask, maintain your distance, and sanitize frequently. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer, who will give us an update with respect to the Health Emergency Operations Center situation report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. Again, this afternoon, it's my task to share with you the HEOC situation report for today, February the 3rd. So between March 2020 and present, the Federation of St. Kitts and Nevis have reported a total of 39 confirmed cases of COVID-19. 36 cases have recovered fully. At present, we only have 3 active cases. These cases are being monitored as we speak. It's over a year now that we have been experiencing this outbreak from the SARS-CoV-2 virus. And so for this time period, over 103.2 million persons have been confirmed with this disease, and over 2.3 million persons have died from this microscopic organism. 26.4 million of these individuals, meaning those confirmed, reside in the United States of America, and over 446,000 died in the United States of America from COVID. Amongst the CARICOM member states, collectively, They have reported 92,048 persons confirmed with COVID-19, and they've reported over 1,704 deaths so far. Now this slide just provides you a snapshot of what's happening in the neighboring islands. So at present, our sister islands, a few of our sister islands are experiencing clusters of cases and community transmission. So in Anguilla, there are only 17 cases so far. They've reported 2 cases within the past fortnight. Antigua and Barbuda, their total number of confirmed cases stands at 234. Barbados, the total number of confirmed cases of COVID-19 is now at 1,558. St. Lucia, 1,411, and St. Vincent and the Grenadines just passed the 1,000 mark. It's just over 1,000. So this just gives you an idea as to what's happening, what's the COVID-19 status in our neighboring islands. In St. Kitts and Nevis so far, we have conducted well over 8,293 tests, meaning RT-PCR tests, and of this 8,293, only 39 have been returned as positive, giving us a positivity rate of 0.4%. Again, last week I would have shared with you that another batch of RUSVM students was repatriated, a total of 147. 2 charters came in last Wednesday, one from Miami, one from Puerto Rico. So today, these students, these 147 students would have completed 7 days in quarantine. They have a remaining 7 days to go before they would be tested. So they will be tested on day 14 of quarantine, and once their results are negative, they would be officially released and allowed to integrate into our society and attend classes on the RUSVM campus. So at present, we have a total of 426 persons in quarantine, and as I said before, we only have 3 active cases. So these 3 cases are in isolation. They are stable, and then as I said before, 36 of our cases have fully recovered. All right, so this afternoon we are going to just look at what's happening in terms of COVID-19. Now, the emergence of SARS-CoV-2 variants is of concern. So at present, there are 3 SARS-CoV-2 variants of public health concern globally. All right, so there's one variant which was identified in United Kingdom, another variant in South Africa, and another variant a little closer by, and that's in South America, Brazil. So the UK variant, based on the studies that have been completed so far, it's estimated to be about 50 to 75% more transmissible than the original strain, and additional scientific information informs us that there is realistic possibility that infection with this variant is associated with an increased risk of death compared to infection with a non-variant COVID-2 virus. So to date, this UK variant has been identified in the Caribbean. So I think there are at least 3 CARICOM member states on which this variant has been identified, and then it has spread to over 50 countries globally. The South African variant was first identified in South Africa in October of last year, and as of January of this year, already it has been identified in no less than 20 countries globally. This variant too seems to be more transmissible than previous variants, and this particular variant is associated with the possibility or the potential for reinfection. All right, so you could be diagnosed with COVID, recover, and then if you're exposed to the South African variant, you can come down. The chances are, or the risk of you being reinfected with this variant seems to be increased. The Brazil variant was first identified in December of last year, and to date it has been identified in 3 countries so far, and this variant is also associated with increased transmissibility as well as having the potential for reinfection. So in essence, we need to be wary of these 3 variants because they are all more transmissible. So that means the risk of more persons coming down with the infection is higher, and by extension, once you have more persons infected, you will automatically get more deaths. All right, 2 of the variants are associated with an increased prospect of reinfection, and 1 seemed to be associated with higher case fatality. However, based on the information so far, there appears to be no real change regarding the impact of the COVID-19 vaccines, meaning the leading COVID-19 vaccine candidates. So says the Director of Immunization, Vaccines and Biologicals at the World Health Organization. However, please note, scientific work and research continue regarding these 3 variants. So we will await further information, regarding these variants. However, our position locally or here in the Federation is that we really need to keep these 3 variants away from the Federation for as long as we possibly can. Just as we did the original strain, we were one of the few islands not affected by COVID last year. And so our aim is that, we won't be affected by any of these variants anytime soon. So that's our aim. And we need, everybody on board in this regard. So how can we achieve this? Well, we can if we get even more serious about the COVID-19 prevention and control measures, the wearing of the face mask. When you look at the literature right now, in those countries, meaning the United Kingdom, Brazil, and South Africa, individuals are now walking around with 2 face masks as opposed to 1. And the hope is that will reduce their risk of picking up this variant, which is associated with increased transmissibility. So wearing your face mask, very important, hand hygiene, and avoiding gatherings, medium-sized, large gatherings of persons. These measures will prevent the spread of any of these variants if they are on island. Very important. We were told yesterday that we come to this, in this forum, and we keep repeating the same things over and over again, and action is required. And I think the action that's required is for persons to recognize that, yes, each and every one of us, we have a responsibility to reduce the spread of COVID-19 virus locally. And there are some simple measures that we can practice, like wearing our face mask, hand hygiene. I've gotten accustomed to wearing the face mask now. And so, it will soon become a part of you. And it's important because that's going to reduce the risk of transmitting this virus. Okay, so what's happening in terms of the COVID-19 vaccines? To date, there are 63 vaccine candidates in clinical development, and about 16 have reached the stage of phase 3 clinical trials, whereby they seek to get all the medical information regarding the vaccine candidate. Now, 13 vaccines which have completed some level of phase 3 trials. You know, their data have been submitted to the World Health Organization for consideration under its EUL assessment process, emergency use listing assessment process. So 3 vaccines have been submitted for consideration, and as we speak today, February the 3rd, only 1 vaccine candidate has already been approved by the World Health Organization EUL system, and that is the Pfizer-BioNTech vaccine. So, as I said before, the Pfizer-BioNTech vaccine has already been approved by the World Health Organization emergency use listing process. The AstraZeneca and Oxford vaccine is close behind. It's expected to be approved within the first week of February, so that's any time now. Okay, so it's important to note that there are some Caribbean islands, that have already received and approved vaccines. So the United Kingdom overseas territories, which include Anguilla, Bermuda, British Virgin Islands, Cayman Islands, Montserrat, Turks and Caicos, they've already received the first batch of their vaccines, along with Guyana. Now, I want us to note that in St. Kitts and Nevis, the Ministry of Health, in particular the Minister of Health, let me just back up. The Federation signed on to the COVAX facility. We've shared this repeatedly. The COVAX facility is a global mechanism which was developed to help participating member states gain access to these vaccines. When you look at CNN and BBC, you realize it's only the bigger countries to date. They're the ones who have received vaccines. And so smaller territories like ours, we can access or gain access to the COVAX facility. So the Minister of Health recently received a letter from the Office of COVAX facility providing us information regarding the first tranche of the COVID-19 vaccines that we will receive through this facility. So we were informed that we can expect to be distributed an indicative number of doses of the AstraZeneca and Oxford University vaccine. We have been allocated 21,600 doses, which will provide coverage for approximately 20% of our population. The start date of delivery is or can be as early as mid to late February. However, they were very particular in noting that this estimated delivery time is subject to change. It depends on a number of factors, and some of these factors include the World Health Organization emergency listing approval process and completion of the next steps. For example, the implementation of our vaccination deployment plan and the regulatory preparedness. Now, the estimated supply schedule indicates that 25 to 35% of this amount will be supplied probably towards the end of the first quarter, and 65 to 75% in the second quarter of this year. All right, it's important to note, ladies and gentlemen, that the Federation is also seeking access to COVID-19 vaccines through other mechanisms. And in particular, we are seriously exploring access to these vaccines through two other mechanisms. Access to the COVID-19 vaccine is crucial to curbing the spread of COVID-19 infections and restarting our economy and the economies in the Caribbean region and further afield. Okay, so what's the way forward? We are at the beginning of February, and it's about 1 year now since we have been engaged in this COVID-19 response. We've done very well, and so the question is asked, what's the way forward? And so we must, number one, we must continue to adhere to our St. Kitts and Nevis health and travel protocols, our requirements, which entails the pre-arrival RT-PCR COVID-19 test done within 72 hours of arrival is very, very important. We must continue that. And our 14-day quarantine or vacation in place, and it has been criticized. However, it is a best practice, and it has served us well when you compare what's happening in our neighboring sister islands. Number two, we must continue to maintain border surveillance. Ladies and gentlemen, we must continue to monitor our borders. Number three, we should or must access COVID-19 vaccines. The plan is to access enough vaccines that provides coverage for at least the first 20% of our population in the first instance. And then the ultimate goal is to attain a coverage that approximates the herd immunity threshold. The science is still out on that, but based on what we know about vaccination and herd immunity, it can be about 70, 75, 80%. So it really would be ideal if we can achieve the herd immunity threshold. If we do, this will reduce the risk of clusters of cases occurring and even community transmission. So ladies and gentlemen, I want to share the bigger picture. It would be nice if we can go through this pandemic with just a few cases and not experience any cluster of cases or community transmission. We can do so if we hold strain and continue doing what we have, and even be more effective in doing what we have been doing until we gain access to the vaccines and start to roll out the vaccines. Because once you start vaccinating our population, the individuals who are vaccinated, they would develop some level of immunity having received the vaccine. And so if we are exposed to the virus, it wouldn't take hold. We won't get clusters. We won't get community transmission. And so that's the bigger picture. And I hope I'm being effective in communicating this, because, I want us to see the bigger picture, buy into the bigger picture, and we can all work together to achieve this. We must maintain the COVID-19 prevention and control measures. So, at one forum this week, somebody says, you keep repeating the same thing. We need action. Action, let's all endeavor to protect ourselves and others by wearing the face mask, maintaining good hand hygiene when you go to the supermarket, when you go to the market, when you go to the restaurant, when you go on the strip. Maintain the adequate distance, avoid crowds. And if there is a small household party or gathering, pay attention and try your utmost best to operate within the context of what we've been sharing. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdia Samuel, who is the chair of the COVID-19 National Task Force and National Disaster Coordinator, to bring us his report. Mr. Samuel.
Thank you, Mr. Williams, and a pleasant good afternoon to all who are watching and listening via all the various means. Our National Emergency Operations Center's briefing for today. I want to focus on some comparisons of what is happening around the Caribbean region, and I want to highlight 4 specific countries in my presentation: Barbados, Antigua and Barbuda, St. Lucia, St. Vincent, and the Grenadines. In Barbados, as we just heard, this is basically, you will see the dashboard here. Right, and this is what is happening in Barbados at the present moment. And as a result of this outbreak in Barbados, a number of control measures have been put in place in order to mitigate and reduce the rise of COVID-19 infections. So the Prime Minister of Barbados, the Honorable Mayor Motley, has decided that there will be a lockdown in Barbados. So effective Tuesday, 3rd of February, they will go into a curfew from 7 p.m. to 7 a.m. And in her words, this was indicative of her to control the spread. In particular, when there was 3 deaths of elderly persons within the week. But equally so, they also identified that 3 cases of the new variant, of the UK variant, was identified in Barbados. So this has resulted in supermarkets being open from 8 a.m. to 3 p.m. from Mondays to Fridays, and then lockdown on the weekends. Businesses, including bars, restaurants, gyms, will be on lockdown. Banks will be open just for 6. Will be shutting down for 6 days, February 3rd to the 6th. It's important. I want to highlight to this because we remember going through similar activities, and we should aim not to get back there. And it's very important. Let us take a look at Antigua and Barbuda. This is a graphic of the dashboard, and we see the cases, the active cases in Antigua and Barbuda. As I was preparing my presentation, one of my colleagues shared with me one of the control measures they have now implemented in Antigua and Barbuda. With immediate effect, all schools have been closed and moved to remote learning. And if you look at this slide, you will see what was the minute paper that was sent out in Antigua and Barbuda. I don't think we really want to go back there as a nation here in St. Kitts and Nevis. Let's take a look at St. Lucia. St. Lucia, the Honorable Alan Chasnet, Prime Minister of St. Lucia, has instituted a state of emergency, and they have returned to curfews. So, effective the 3rd of February, St. Lucia will be going into curfews from 7 p.m. to 5 a.m. Sorry, effective today, Wednesday the 3rd, for 7 days in the first instance. Why? With 757 active cases, it's difficult for St. Lucia to have this under control when they are moving pieces. Remember this, the virus does not move. People are the ones who are moving the virus. Let's just take a look at St. Vincent. St. Vincent and the Grenadines, who are actually doing 5 days of quarantine in a government designated facilities and also 9 days at home. They now have gone to a significant outbreak with approximately 782 plus active cases and rising. What are we going to do here in St. Kitts and Nevis in order to mitigate something like this happening? And I will outline our mitigation strategy going forward. 1, strengthening the corridor of containment. What do I mean by that? From the time you arrive at the welcome center, the screening process at the health desk, immigration desk, the custom screening, and the dispatching on the outside for the ground transportation. Also, your arrival at the quarantine or vacation in place facilities. 2, we are going to increase the screening, surveillance, monitoring, and enforcement through the deployment of more human resource and equipment within strategic areas in the Federation. 3, increase in testing, the ability of having more laboratories coming on board to help with the testing capabilities. 4, amendment to the legislative framework for stricter penalties for those who breach the protocols. 5, an increase in public awareness campaign and compliance and the importance of vaccination. Remember, having the vaccine is one thing. If we do not take the vaccine and vaccinate the 70, 75, 80% of the population, then accessing the vaccines will be futile. So we want to encourage you, we want to educate you so that you can come on board and take the vaccine. 6, audit the government-approved quarantine and vacation-in-place sites. We want to make sure that periodically we audit these sites so that there is full compliance and ensure that these sites do not become an epicenter for any outbreak in the Federation of St. Kitts and Nevis. Again, I want to encourage you to continue with the non-pharmaceutical measures, social and physical distancing, wearing of the face mask, hygiene, and wearing your face mask is very important. I think we have reached a false sense of security in the Federation of St. Kitts and Nevis, and I am appealing to one and all to wear your mask. I want to thank you for listening, and please do your best to adhere to the protocols. We are here to work with you. Actually, today makes 1 year since we had our first press conference in 2020 regarding our preparedness and response for the novel coronavirus. We have done extremely well. However, we must continue this, and we can only continue it if you, the general public, as the major stakeholder, do your part. I want to thank Rebecca's Kitchen for the wonderful watermelon ginger. Am I correct, Vesta? Yes. Watermelon ginger and the nice cake she has provided us to boost our morale. Thank you, Rebecca's Kitchen, for doing so. Thank you, Mr. Williams.
Thank you very much, Mr. Samuel. And our first question of the day, I understand that they have closed down Jacta, what we know as the Royal St. Kitts Hotel, to the general public. I know when you go there, you adhere to all the protocol. The people who are in quarantine are sectioned off. It's highly unfair that Park Hyatt restaurant is open to the public and they have the same quarantine guests as Jacta. Also, the casino in Marriott is open to the public. I would suggest for them to put stickers in place and keep Jacta open. Mr. Samuel, you'll take that?
Okay. Mr. Williams, thank you for the question, and let me address this question cautiously. The Royal St. Kitts Hotel was designated to provide 2 types of services. One was vacation in place, and one was quarantine. We have experienced some challenges within the designated facility, and what we are doing, as I just outlined in our mitigation strategy, is doing some audits. So in doing these audits, there are some measures that we have to implement in the interest of public safety. And what we have done is paused a number of activities until the corrective measures have been put in place.
Thank you. Another question, Mr. Samuel, has to do with alcohol. Apparently, alcohol seems to be an issue, and some people are wondering what are the rules pertaining to having alcohol in quarantine.
There appears to be some misunderstanding, but I believe any adult who is in quarantine, they can imbibe if they want to. What you have to understand, though, that if you imbibe to a degree where you are not abiding by the rules and regulations, then the police will be called. I believe where the confusion arises is that students who are quarantining, they are not supposed to have alcohol, but an adult who goes to the Park Hyatt or the Marriott or even Royal St. Kitts, they can have an alcoholic drink.
Thank you, Mr. Williams. I just want to add to what my good colleague, Dr. Wilkinson, just said. At the OTI, there was a policy that was adopted very early in terms of alcoholic beverages. The security forces, who are the ones who carry out the security and other compliance measures there at this facility that is being run by the government, earlier on we took a policy whereby no smoking and no alcohol would be permitted in and around OTI because of the challenges that have been faced in the past by the security forces. So in order for us to maintain a safe and secure premises, we decided that for these 14 days there will be no alcohol in this particular facility.
Thank you for your responses. These questions are from WIN FM. There are concerns about the spread of the new variants, especially since they are currently present in Barbados, St. Vincent and the Grenadines, and St. Lucia. Are there any extra measures expected in response? What would the extra measures be? Dr. Wilkinson.
When I hear people speak about being concerned about the spread of the new variant, I ask them where they were from January last year, because we should all be concerned about the spread of COVID-19 to begin with. And the measures that one need to take to control the spread of the original virus are the same measures we need to take to control the spread of the variant. And that is one of the reasons why we keep re-emphasizing, and I hate to sound like Groundhog Day, social distancing, wearing your mask, hand sanitizing, etc. And for the COVID-19 task force, sometimes it becomes very frustrating when we have to be fighting the same battles over and over again, where persons want to have mass events. People want to show up in a stadium with 1,000, 2,000 persons. People want to have events above and beyond the 150 that we said is the maximum. And so this is the way you control the spread of the variant. You can control the spread of the variant also, even though there is a hotel that is allowing quarantine and they're open to the public. You can choose not to go there because you know if you go there you might be putting yourself at increased risk. And so we just need to continue to do the things that we were doing for the original virus, and that will help us to control the variant.
Dr. Wilkinson, I like when you tag me and we come here and educate. Also, in the past, you have seen that when there is challenges with viruses or whatever it is in other countries that are maybe source markets, or we have large communities here in St. Kitts and Nevis, one of the things that we have to do is restrict travels. We have seen around the world and even in the Caribbean where some countries have taken proactive measures in restricting or limiting entry of persons or travelers from these countries to their country in order to reduce the possibility of importing the new variant into the Federation. So possibly that can be a consideration that can be recommended here in St. Kitts and Nevis.
We realize that Anthony Fauci, the chief epidemiologist in the U.S., is warning there about the Super Bowl and having basically parties and all of that for the Super Bowl, which he said it could really be disastrous if they do. The other question from WinFM is, can we get an update on the enforcement of mask wearing in public places, boats, buses, etc.? How many tickets have been given for violations of not wearing masks? Superintendent.
My response from the last time this question was asked has not changed. We are still awaiting the printing of the tickets, and as soon as they're ready, we would have the enforcement going on. But as again, we hope in the meantime persons would use the opportunity to really have some self-discipline and not wait until someone have you pay to wear a mask, but voluntarily wear your mask. It's for your own safety.
And this is the last question for the day from Von Radio. Can you explain the procedure or what is expected at the quarantine sites for all inbound passengers, as we are learning that some persons who are in quarantine are mingling with other persons? Is this supposed to happen? Dr. Laws.
All right, so if you are an inbound passenger, the terms and conditions depends on where you are in quarantine. And so if you are at the Ocean Terrace Inn, if you are at the Bird Rock Beach Apartments, or if you are staying at Ocean Edge, you are in quarantine. So that means you are confined to your rooms for the 14-day period. You will be tested on day 14. You await your result. Once you are negative, you are officially discharged from quarantine. Up until this past weekend, if you are in quarantine at the Royal St. Kitts Hotel, at the Marriott Hotel, Marriott Vacation Club, Park Hyatt, and Four Seasons, and two other hotels in Paradise Beach and Golden Rock, you could be vacationing in place. All right, so there are two differences. Quarantine, you're confined to your rooms for the 14 days. Vacation in place, you are confined to the property, the hotel property, for 14 days. However, you can come out to your room and access some of the services that are offered at the hotel. And these include food and beverage. You can probably go to the sea, the beach, if the property is on the seaside, or you can use the swimming pool. All right, so that's the difference. Quarantine, you are confined to your rooms. Vacation in place, you can exit your room door and access some services on the hotel property. However, you're confined to the hotel property, cannot leave the property. And so that's the demarcation, and I figure, that's the little bit of confusion, the individual wants some clarity on. Thank you.
Thank you very much, Dr. Laws. And that brings us to the end of our question and answer segment, and also the end of this press briefing for today. I want to thank all of the persons who submitted questions, who were truly concerned and genuinely concerned in terms of what is happening. We are here to provide you with answers to your questions because, of course, all of us, we're in this together. I think it was the reigning Calypso monarch that said that we are all in this together. And we all have a responsibility, but we also have responsibilities to do what we should do. I want to thank Mrs. Christmas Jacobs for her continued service of sign language. I also want to thank ZIZ and all the media for continuing to partner with us in terms of the dissemination of information with respect to the COVID-19 pandemic. Ms. Vesta Southwell, we want to thank Ms. Ophelia Blanchard, we see Nigel Farrell, Dr. Marissa Carty. They all play an important role in terms of communications here at the NEOC and the Ministry of Health. We thank Dr. Cameron Wilkinson, our Medical Chief of Staff, who continues to be very faithful to the cause, and Dr. Hazel Laws as well, our Chief Medical Officer. Superintendent Cromwell Henry and our Chair of the National COVID-19 Task Force, Mr. Abdius Samuel, and the National Disaster Coordinator. Also, we continue to thank all of our frontline workers, the people who are working in data entry, and every one of you who continue to play your part in keeping the Federation of St. Kitts and Nevis safe. Thank you very much. Next week we will be back for another press briefing on Wednesday, the 10th of February. Until then, take good care. I am Les Roy Williams.
Is on.